Are you a medical PG who thought that just by clearing the first year of PG life, you have got everything under control? Nah, you're thrown into District Residency Program, aka DRP. Hello everyone, welcome to my YouTube channel Go With The Flow. For today, I'll be talking to you about DRP. What is DRP, why it is done, who made it, and why particularly we are attending it, and the most important thing, how can you survive the DRP? What exactly is this DRP thing that I'm talking about? This was a particular implementation by the NMC in 2020 from the batch of 2021 that every postgraduates that's studying in India have to undergo this district residency program where they'll be sent for 3 months of rural postings. It can be either in a district hospital, a community health center, or even a public health center. The next big question is, who has to do it? Anyone who is pursuing MD, MS, DNB has to do it. There are no excuses and exemptions. Yeah, actually one exception, only if you're invisible. So why was DRP implemented? 80% of the doctors lives in the cities, whereas 75% of India lives in the village. This could actually help medical postgraduate to get a better exposure in the community level. Let's do a reality check of DRP. Sometimes when you go to a particular place, you will understand you're the only specialist who is available in the entire area. Secondly, this is supposed to make us better clinicians. How? Handling emergency cases without the help of CT scans, MRI scans, or even the basic blood investigations, because half of the time the labs don't work. And if you are a psychiatry resident like me, you might be the one person mental health department in a particular entire district. You know how overwhelming that is? Because every case of depression, anxiety, psychosis, schizophrenia, alcohol withdrawal, every kind of substance abuse are going to come in your way. You're without any seniors, without a proper psychology department. Your skills, your knowledge in ICD, DSM, CTP are going to help you in the last minute. And I've heard a lot of residents coming from DRP saying that they learned more about their branch and subject when they went for DRP, because I think they saw a lot more cases. One time you will be talking to a patient, counseling that patient about depression or anxiety, whatever the case of psychiatry it is. Then the next case that I'll be seeing is a bronchiectasis, or I'll be seeing something related to the CLD, because usually psychiatry PGs will be posted in internal medicine because psychiatry branches are very rare in rural setup. So if you're a psychiatry PG like me, get ready, because you have to revise your Harrison and Davidson before even thinking of going to DRP. So the main 3 survival tips that I can give you to make your DRP the best experience is by making friends with the staff and the nurses, because they handle the hospital and they rule the hospital. Mark my words. Stock up all your essentials. Really, literally, I mean it. You should definitely have a stethoscope, no matter whatever branch you are in. You're clinical, paraclinical, no matter. Have a stethoscope. You're going to need it. Second, water. I don't know which part of the country you are, whether it is cooler in that part of the area or not. Hydrate yourself, because I am in the warmer side and I am drenched in sweat, and if you have dehydration, your brain is not going to work. Make sure you are hydrated. Okay, do that for yourself. Do it. And have your breakfast and make sure you stock up snacks to stay calm and understand and learn each case, because it's going to do wonders for you in your particular branch. No matter wherever you're posted, try to learn something from each patient. As for me as a psychiatrist, rural area does not have a particular idea about mental health. They're going to come and tell you that they are having headaches, stomach aches, or some kind of bodily pains. When you try to decode them more, you understand, no, it's actually depression, it's actually anxiety. We had certain patients who were on painkillers for years. over the counter and from different doctors, because they will not stick to one particular doctor. They're going to go to multiple doctors. Why? Because they want the pain to go away, when the actual pain was emotional. They might have lost a loved one, or they might be having deaths. End of the day, DRP is not just about working in a rural area. It is of helping people experience what they should literally experience from us doctors: care, empathy, and proper treatment. Trust me, this DRP thing is tough, but it is going to make you smarter, tougher, and moreover, you are going to understand people more, because whatever empathetic side that you think you don't have will be ignited after the moment you go for a DRP posting. And the best thing that you can ever get is the feeling that yes, I have done my part, or I have done something for the society. That feeling itself is so filling. It kind of makes me happy. So that's the main reason why I thought I need to put this video up there for anybody who doesn't know what DRP is. So with that, we're coming to an end of the video. So let me know in the comments if you really like DRP and you think it was helpful, or if you think the DRP was a burden. And don't forget to comment your most craziest experience that you have had during your DRP times. If you find this video useful, make sure you hit the like button and you subscribe to the channel and share it to your friends. And we'll see you in the next video. And make sure people always and always go with the flow.